There are currently 7.5 million Americans with diabetes who rely on insulin to survive. Yet, despite some measures making the drug more affordable, it is still difficult for many patients, particularly those who are uninsured or underinsured, to purchase the insulin they need. With the help of a doctor at any clinic or office in the United States, these patients can receive cheap or free insulin through each company's Patient Assistance Program, or PAP. This video will explain how to apply to patient assistance programs and will offer a few tips to ensure that insulin is actually delivered to those who need it. The video features Dr. Connie Faltynek, a medication coordinator who works at the Spanish Catholic Center in Washington, D.C. Links to forums for these PAPs are provided in the description of the YouTube video and at the end of the video.
For our clinic, the patients must be uninsured and low income. That's all our patients at this clinic fit in that criteria. Most of the major pharmaceutical companies do have programs to help patients who need medications but they can't afford them. And so they have different programs depending on if someone is insured or if they're uninsured patients. For uninsured patients, when we get them from the pharmaceutical companies, they come absolutely free, no charge whatsoever. Yeah, there's three major companies, pharmaceutical companies, that provide most of the insulin that's involved in. So basically you go through one of those companies, depending upon which type of insulin that the patient needs. And also depending upon their level of documentation. Some of the companies are not so stringent. We have about, in my programs here, we have about 50 patients who are diabetics. Of those 50 patients, about 19 receive insulin through the program. To get the medications from the pharmaceutical companies, they have well-defined criteria, which means that the household must have income that's less than or equal to 300% of the federal poverty level. And so it depends upon the size of the household. So if there's one person, that one person could make up to $41,000 a year and still receive free medications. If it's a family of four, they could have income up to $83,000 a year and still receive free medications. This is not exact. It changes every year depending on what the federal poverty level is. Some companies use 250% of the federal poverty level. Most of them use 300%. Sometimes for the very, very expensive medicines, they'll go up to 400%. Some companies need to have documentation, like a 1040 from income tax, a W-2. If they don't have that, they'll take like pay stubs. They have to be recent pay stubs, whatever, and it needs to be for every person in the household. Mm-hmm. Now, for people who are new immigrants or other people who are undocumented, they obviously get paid in cash. Mm-hmm. That can be a little bit of a tricky thing. Some of the pharmaceutical companies will not take a patient unless they have real documentation, whereas some of the others, they'll take a letter, and the employer will just write down, this person works for me, he gets paid this much, and sometimes they'll take that, but it varies with the company. If the pharmaceutical company denies a patient, said that they don't qualify, that usually is because they don't have enough documentation. It also can be sometimes because they're very low income, and then some of the pharmaceutical companies say, oh, you have to apply for Medicaid. We're not going to give you free meds that you've applied to Medicaid, and then they will supply it with the medication. But if Medicaid says no, then you can go back to the pharmaceutical company and they'll take the patient. But if that doesn't work, then the patients have to purchase. The patient will need to be a patient here. They need to have a doctor that they work with, and the doctor has to say, yes, the patient needs insulin or one of these other things.
So they can't do this by themselves? No. They have to have a doctor?
They have to have a doctor.
Okay.
Yeah. And they have to have a doctor because it has to be recommended by the doctor. The doctor has to say what the diagnosis is for the patient, and the doctor has to say this is what the patient needs, and the doctor has to sign off on it. You do have to put in what other medications they are taking, because you have to be sure that there aren't any drug-drug interactions. Mm-hmm. And no good pharmacy would dispense a medication without knowing what other types of medications the person is taking, because drug-drug interactions can be very serious. The doctor would, I fill this out and then just get the doctor to sign. They have to say that it really goes to that patient. Once again, they can't sell it or give it to a different patient. So they have, it's a lot of legal stuff. The patient really has to sign, say that they consent to having this information be released to the pharmaceutical company, and they need to provide honest information about their income. And that's all they have to do. This is a patient section, information about their address. As I was mentioning, the size of the household is important, and income is important. Then you have to say if you don't have insurance or you do have insurance. So they have to sign the following things. They have to sign that they won't give it to anybody else. They have to say that the receiving entities will use the information in the application, but they don't have any other information about medical conditions that are not necessary for applying for this. I have not had any issue with anybody saying that they did not adhere to my request, that they don't share other things. There are some patients who will not sign.
And they don't want to do the program?
They don't want to. Yeah, it's very rare. Most of them want to do it. Well, I keep track of when I ordered something, and if it usually takes about 2 to 4 weeks before we know whether or not it's been approved. If it's been about 4 weeks and I haven't heard anything or it hasn't come, then I try to contact the pharmaceutical company and say, okay, what's happening? What happened to one today was that I hadn't heard, and it turned out that the form I had was an old form. They had an updated form. I hadn't used it, so I have to start over. I would say document, keep track of when you order things. If it's initial application, allow up to a month before you start trying to track it down. If it's a refill, I usually say a couple weeks and track it down. So just, document when you ordered it. If it hasn't come, contact the pharmaceutical company, what's happened. Sometimes they send it to the wrong place. That happens sometimes, then you have to track it down, where it went. We always have things come here. We've had some problems with things going to people's houses and the medications disappear. Sometimes it's apartment buildings, and there's a lot of traffic in and out of the buildings, and people see these all come in coolers, and they're pretty big, and they sometimes don't find their way to the patient. So we have all the insulins and these other medications come here. And then when they come, then we call the patient, and the patient comes to pick it up. We usually get 3-month supplies or 4-month supplies, so it isn't that they have to come, every few weeks or something, because that would be hard for patients. When we need a refill, it varies. Some have an automated system that is very good. Just give the name. You need the prescription number, which I always have because the meds come here. You need the prescription number, the name of the patient, date of birth, and just say it's automated. Say this is the name of the patient, and it comes up. Are you requesting X? And I say yes, and then they say this is approved, and they say expected delivery date is. That's the easy one. I like that one. Some of the ones that have a form, like for Lantus, for the insulin, you have to do it. It's just a 1-page form, but you have to fill out the form. Nobody has to sign it. I just fill out the form and fax it in, and that works for them. Some of the others, you have to call on their automated systems, and they're not very good. You have to answer lots of questions sometimes. I guess they want to be sure that I am who I say I am, and I represent the patient, and I know who the doctor is, and the doctor's license numbers, and that sort of stuff to get refills.
But so far as the patient, they don't have to do anything. But this is all for you. Okay.
Yeah, they don't have to do anything until it's time to re-enroll.
Every year.
Once a year. Then we start over. We've had some that were enrolled in the program and then later they were not. And I don't know if it was because they changed the criteria. Sometimes they change the criteria in terms of how much documentation they want. So occasionally, it doesn't happen often. So we do get the different other medications for diabetes. So same kind of process. I work with the pharmaceutical company to get that particular medication for the patients. It can become difficult and sometimes to get some of these because these are very, very expensive. People should use these patient assistance programs. They're there. They're there to be used. And I think a lot of people aren't aware of them. If we could raise the awareness of these programs because patients really need them, and some of the pharmaceutical companies are very good.
The key points to take away from this video is that each patient assistance program is different for each company. All uninsured patients below a certain income level will receive free insulin from these programs if they first share income information and sign a form. They're also required to have a doctor who has to fill out a form regarding the patient's medical history, and most importantly, the doctors or the clinics must follow up with the companies after submitting their application. And furthermore, the second most important thing to do is always ensure that all forms a doctor is using is completely up to date prior to using them. It typically takes 2 to 4 weeks to approve these patient assistance program applications, and it typically takes about 2 weeks for a refill of the insulin or medication. And after 1 year, these patients on these programs must re-enroll. These links are all available in the description below as well. Hopefully this video will encourage more clinics around the country to use patient assistance programs. As Dr. Faltynek said, these programs are there to be used.